My name is Aris Knight. I am an assistant professor at the Department of Ophthalmology for the University of North Carolina School of Medicine. It is important for African Americans in particular to get checked for glaucoma because, just as a matter of fact, African Americans are at least 3 times more likely to have glaucoma than their Caucasian counterparts. And African Americans are more likely to lose vision and go blind. African Americans tend to have vision loss symptoms significantly earlier, at least 10 years earlier in life than Caucasians. And knowing all these things and knowing that there are some issues with access to care and so on and so forth, it is of particular importance for African Americans to get checked for glaucoma. It's important for patients with glaucoma to ask me any questions that they have because an informed patient is an empowered patient. Oftentimes patients are unfamiliar with glaucoma in general, and even with me diagnosing glaucoma, they may not be feeling symptoms. So it creates a bit of a knowledge gap. I think when patients ask questions about glaucoma, I think it gives them a better sense of what to expect with regard to the vision loss that they may experience, the vision loss that they're able to prevent, their treatment options with regard to medications and surgery. And I think that constant back and forth between me and the patient actually makes them feel more empowered and tends to lead to better outcomes.
My name is Ivory and I'm 60 years old. I was in my 30s and was a suspect for glaucoma, and I was originally diagnosed with it when I turned 56. When I learned that I had glaucoma, I asked all kinds of questions because that's just the type of person I am. And I did a lot of research because in African Americans it's more prevalent. And the first thing you know, when a doctor give you that you have glaucoma, you think, you know, am I going to go blind? So I think that a person should just ask what you feel, or if you have questions, ask, or either do research on your own. I think African Americans should be checked because it's more prevalent in African Americans. And no one knows why it's the leading cause of blindness in African Americans, one of the leading causes. So with knowing those facts, you know, if you feel anything different or see anything different, your vision or anything, you know, mention it to your doctor because it could be something going on. I would tell someone that has never been checked for glaucoma or not getting checked, if it's a family history, you know, even though you're young, you know, a lot of diseases, they say, well, you know, it doesn't happen to people at, you know, everything is a certain age, and that's not necessarily true. If you have a family history of glaucoma, or if you're having any type of issues with your eyes, like with me, mine started with floaters. I had a lot of floaters. And I said, something's just not right here. So that's when, you know, from your optometrist, if you tell them what's going on, then they can refer you to the proper doctors. I feel that some of the barriers for African Americans not getting checked, it may be their health insurance. It may be that they just don't go to the doctor regularly. You know, optometrist, I'm not having any trouble with my eyes, so why should I spend the money? That's what I feel. Maybe some of the barriers. I think patients should ask the doctor what type of glaucoma it is, because it's different types. What type of treatment will they need? Will they be on the medication forever or a short period of time? What does field testing mean? What does, you know, anything concerned with your eyes, the different tests and stuff they do, what does these things mean and how will they affect, you know, a person in the long run? My strategies are I take notes. And if something has happened differently since I last saw my doctor, I jot that down. That's the way I do. And so I can ask questions about it. You know, like if I have pain behind my eyes or feel like headaches over your eyes, what does that mean? Because sometimes they'll go in and do different tests and just see what's going on with you.
My name's Anthony, and I'm 63 years old. When I learned I had glaucoma, I was 59 years old. Questions that patients hesitate to ask or don't ask and should ask their doctor: how serious is it? What can I do to control it? How long do I have before I start losing my sight? Or will I lose my sight? Or will the medications keep me from losing my sight? Some of the strategies that I've used to remember to ask questions when on my doctor visit is when I think of things that I need to ask him, I will jot them down on and take them to my next visit. When I have my medicines, I put the note beside the medicine so I can make sure that when I go there, I can remember to take them. When I found out I had glaucoma, I did not know anyone else who had glaucoma. I don't know of anyone else in my family or friends who has glaucoma. It is important that African Americans get checked because I just found out through studies that African Americans are one of the largest populations that get glaucoma, that have glaucoma. And African Americans are, fortunately, a group that hate going to the doctor and neglect their health. And the eyesight is one of your most important, if not the important aspect of your health, because you really don't want to lose your eyesight. So I would suggest that they would go to their eye doctor, get an eye doctor if they don't have one at least, and get one and go at least once a year. The advice I would give to someone who has glaucoma is to keep regular checkups. Keep taking your eye drops, using your eye drops. Ask any questions that you have about your eye drops, about the use of your eye drops, or any questions about if you're having any problems with your eyes, immediately contact your doctor or your nurse, or be proactive in your action because your eyesight is very important. You don't want to lose it. You want to keep your sight as long as possible.
My name is Sonia, and I'm 76. How old was I? I think it was like in my late 60s that I found out that I had glaucoma. I guess I'm surprised when I talk to people how little informed they are about their own medical problems. And so one of the things is that if you don't have enough information, you don't know what to ask. So one of the things is to talk with other people. Some of the information that's available now, a lot more of it is available online. When I first went to check it, there was very little, and a lot of it is available now. When you're going to go see the doctor, you should have made some notes about things you want to ask about. Because one of the things that I kept forgetting to ask was how soon after putting the drops in could I take liquid tears? And it took 3 times going to the doctor before I remembered. So it is a good idea if you think of something, even though it isn't time for your appointment, to drop a note in your notebook or something, so you can pull that out and review it with the doctor when he's there. One of the things that I've learned to do is when I do think of something and I have forgotten it several times, I will make a note to myself, and especially when I know that the appointment is coming up, and I will, the morning of it, make sure that I have it in my tote bag, my purse, so I can say, oh yes, I wanted to ask you about this. I think that a lot of times when you get to the doctor, you just don't think of things. I had an experience with a colleague who didn't find out till the disease had gotten worse, that she had glaucoma, and it created a great deal of issues for her eyes. And she finally had to retire from the job that she was doing. And she was young.
My name is Gregory, and I'm 64 years old. When I first found out I had glaucoma, I was 49 years old. Why is it important to ask questions? Because if you've never been sick, nothing's ever been wrong with you, and there's a tendency, I would think, because I did it, to not take it seriously, to not think that I'm not going to go blind. I just will wear thicker glasses maybe, and I'll be fine. And you don't know anybody that's blind, So you see people with dark glasses on, but you don't really know what glaucoma is, so you don't know why they wear them. When you start hearing terminology, that important questions you should ask, you start hearing terminology that you're not familiar with. So he starts talking about eye pressure, diluting your eyes. I mean, those things they're kind of foreign to you, and you just tend to shake your head and say, yeah, but you don't really understand what they are. So eye pressure is very, very serious. And, you come to know that after a while, but I didn't ask those kinds of questions initially. He's from 30 years. I was 49, almost 50. He says, you're going to live another 25 or 30 years. And can you imagine living the last 15 years of your life not being able to see? So I need you to think about that, because this is really serious. The questions I wish I had asked once I learned I had glaucoma, I didn't really know what I had. So I didn't know what questions to ask, and I didn't know how serious it was. So, I don't know about questions I wish I had asked. But one of the things that really made this make sense to me, he put me in with like a consortium, like a group of people who have glaucoma of different age groups. And some of them were a lot younger than me and were almost blind. Some were a lot older than me. And then they start talking about how they came into the glaucoma world. And I started listening to all the things that other people were saying. And I was like, and I thought had problems, but their problems were far greater as far as their vision than mine was. Whatever eyesight you have, do everything you can to hold on to it.